Measles is a highly contagious viral infection caused by the measles virus, which belongs to the Paramyxoviridae family. It primarily affects children, although it can occur in individuals of any age who are not vaccinated or previously infected. Measles is known for its characteristic skin rash and respiratory symptoms, and it remains a significant public health concern in areas with low vaccination coverage. Transmission and spread. Measles spreads easily through respiratory droplets when an infected person coughs, sneezes, or talks. The virus can remain active on surfaces and in the air for up to 2 hours, making it extremely contagious. A person infected with measles can transmit the virus to others from 4 days before to 4 days after the appearance of the rash. Close contact with an infected individual significantly increases the risk of contracting the disease. Measles has a high basic reproduction number, R0, ranging from 12 to 18, which means that one infected person can potentially infect 12 to 18 susceptible individuals in a population without immunity. Symptoms and clinical features. The incubation period for measles typically lasts 10 to 14 days after exposure. Early symptoms include high fever, cough, runny nose, coryza, and red, watery eyes, conjunctivitis. These initial signs are often accompanied by malaise, fatigue, and loss of appetite. A hallmark feature of measles is colic spots, which are small white or bluish-white spots with a red background that appear inside the mouth, usually on the inner cheeks. These spots typically emerge 2 to 3 days before the characteristic skin rash. The measles rash is another distinctive symptom. It usually starts as flat red spots on the face and behind the ears, gradually spreading downward to the trunk, arms, and legs over 3 to 5 days. The rash may merge into larger blotchy areas and is often accompanied by a high fever. Other complications may include diarrhea, ear infections, and severe respiratory issues. Complications. While measles is generally self-limiting in healthy individuals, it can lead to severe complications, especially in young children, adults, pregnant women, and immunocompromised individuals. Common complications include otitis media, ear infection, pneumonia, and diarrhea. Measles can also cause encephalitis, an inflammation of the brain, which can result in long-term neurological damage or death. In rare cases, a delayed complication known as subacute sclerosing panencephalitis, SSPE, can develop years after the initial infection, causing progressive neurological deterioration. Malnutrition and vitamin A deficiency increase the severity of measles, particularly in developing countries. The World Health Organization, WHO, recommends vitamin A supplementation in areas with high measles prevalence to reduce the risk of severe outcomes. Diagnosis. Measles is primarily diagnosed based on clinical features, especially the combination of high fever, cough, conjunctivitis, and the characteristic rash. Laboratory confirmation involves detecting measles-specific IgM antibodies or viral RNA using polymerase chain reaction, PCR, tests. Early diagnosis is important for managing symptoms, preventing complications, and controlling the spread of the virus. Prevention. The most effective way to prevent measles is vaccination. The measles mumps rubella, MMR, vaccine is highly effective, typically administered in 2 doses, the first at 9 to 12 months of age and the second at 15 to 18 months. Vaccination not only protects the individual but also contributes to herd immunity, reducing the likelihood of outbreaks in the community. Maintaining high vaccination coverage is crucial, as measles can resurge rapidly in populations with low immunity. Treatment. There is no specific antiviral treatment for measles. Management focuses on supportive care, such as maintaining hydration, controlling fever, and addressing secondary infections. Vitamin A supplementation is often recommended to reduce the severity of the disease. Isolation of infected individuals is essential to prevent further transmission. Global impact. Despite the availability of an effective vaccine, measles remains a leading cause of vaccine-preventable deaths worldwide, especially in regions with limited health care access. Global vaccination campaigns have significantly reduced measles-related mortality, but outbreaks continue to occur when vaccination coverage drops. Public health strategies emphasize routine immunization, surveillance, and rapid response to outbreaks. Conclusion: measles is a highly contagious viral disease with distinctive symptoms and potentially serious complications. Early detection, vaccination, and supportive care are key to preventing severe outcomes and controlling outbreaks. Continued public health efforts are essential to eradicate measles and protect vulnerable populations globally.